Ashish, who will be talking about how do we go in for accreditation. I think in today's era, every single solo practitioner is going in for this accreditation, whether it is the entry level or full accreditation, and there are a lot of advantages, and I feel everybody should go in for it. And let's hear it from Ashish.
Good morning, everybody. Now, after having a good biometry, starting our social media marketing, then opting for good IOLs, one more important thing in the business of eye care is accreditation. Now, accreditation advantage should one go for it. The first question is that should we have accreditation? Now, National Accreditation Board for Hospitals and Healthcare Providers, that is NABH, and what is this and should we have it is what is my talk about. Now, this is a council, this is a constant board of the Quality Council of India, which has been set up to establish and operate accreditation programs for healthcare. Now, as a hospital perspective, can we do without it? We are as it is providing good quality clinical care. Yes, we have to have it because this is very important for our survival. We cannot survive without accreditation. Why? Because there are a lot of public sector schemes like CGHS, ECHS, Haryana government, Ayushman Bharat. Now these have an undertones that you should have a NABH accreditation. Then only your hospital will qualify for these empanelments. And howsoever good a doctor you may be the best phaco surgeon, but the patient is going to come to you if he feels that your hospital is empaneled and he does not have to pay for it. Besides the insurance companies, though it is not mandatory, but they still say that you need to have NABH and they give a better pricing for it. So, a cashless facility, as I already said, it is a must have, otherwise, the patients won't even enter your hospital. If you do not have an empanelment, you feel that, when I did not have CGHS, I used to think that there are no CGHS patients around. The moment I had CGHS, I realized that there's a good lot of patients who are CGHS empanelment and they give you a better returns. So the advantages to the hospital is that the hospital is going to thrive after the NABH. You need to compete with the market forces and the other hospitals, so you need to have these things. Besides, it also gives you an economic or financial advantage. There are places which give better pricing for NABH accreditation. Just a 15% increase if you actually take that value to the 12 months and then full, the whole budget of the year, you feel that this 15% increase is going to take care of your expenses for accreditation, and in fact you will save more. Now, then again, for every advantage, there is a big headache to have an NABH. There's a lot of paperwork, a lot of filings, registers, documentation, and I feel that all these quality improvement initiatives, you have to have it in your system. It should be the second, thing in you that these protocols have to be made, these manuals have to be made, these registers, the checklist. You have to train your staff so that all these documents are being done as regular protocols. So these unnecessary documentation, sometimes you feel that you are being harassed, you are being unnecessarily doing all these things, but yes, this is a blessing in disguise. In case anything goes wrong, in case you have an endophthalmitis or something goes wrong, the patient complains against you, then the court sees the paperwork. They see your file, how well it is documented, whether you've written everything, you've done a proper consent. So you become medical legally very strong. You can actually face any complication that you have done or has happened in your hospital if your documentation is good. And for this, I would say that NABH is a boom. Even the CMO, if he conducts an inquiry, he will be seeing how you are sterilizing your equipment, whether you are maintaining the registers, whether you are actually checking for your OT qualities, the laminar flow, and all those things. So that time, the regular filling of these registers will give you a lot of satisfaction that you will be able to sail through. As a byproduct, I would say that you can take it as a marketing advantage. As Dr. Anchal had said, that anything you have to actually feel from inside that what kind of unique selling thing that you can have. So this is also a selling proposition that you have an NABH accreditation, so you are taking care of quality, and that is what will attract your patients. Then international recognition, you can use it as a tool for medical tourism. So this kind of logo, guarantee, quality guarantee. You can give a quality guarantee to your patients that, we will try and give you the best because we maintain the highest standards that the government and everybody wants. So, so all these kind of things is this. Then besides that, there's a training part of NABH, which is again very important. You are training your staff so that they do the things in the right way. So even in cases of fire emergencies, we all have these fire extinguishers and all this. We hardly used to take care whether we need to teach our people around to use them. But because of NABH, you are bound to give them training. You are bound to maintain the documents. So you feel that might as well do it. So it is a kind of a force that makes you come out of your inertia and do all those things which you used to ignore. So besides that, if we actually feel that the human error is minimized because you are actually writing down everything that you are doing and you get community confidence, it's an opportunity to benchmark with the best. And if I feel about the government, they have to devise ways to actually check and recheck you guys, all of us. And whatever whatever government comes up with the compliances, it is all because we tend to ignore them and tend to not follow them. So advantage to the customer, the consumer is happy. He sees the hospital is decked up, the hospital, the staff is taking care of them. So patient is always the biggest beneficiary, and if the patient is happy, your practice is going to grow. So staff, then again, the efficiencies and competencies get improved. They are more happy because everything is well documented. Their personal files are made. We are taking care of their health care, their ESI, all because we have to do it because NABH wants us to do it. So my experience in NABH, I have 2 hospitals, and what we do, we started with a NABH entry level accreditation and moved on to the complete. We did hire a consultant initially, but then again after that we have never hired a consultant and we are managing it by ourselves. The most important thing is there are statutory compliances. Try to have those statutory compliances, and there are 10 chapters in the book. So it is like this book, you read it properly, you answer them properly, you have them documented, and you are going to pass this exam. You may have there is something called non-conformities. The moment they are going to come for an assessment, they are going to say that all these things are lacking. Don't worry, you take care of them and they are going to pass you. You will get chances and you will clear NABH accreditation almost 100%. So you obtain a copy of NABH standards, implement it by yourself for 3 months, and then fill the form for application. And once you fill the application, there is going to be a pre-assessment and then the final assessment. So what they are going to do is that they are going to do a proper sample requirements. They are going to visit all areas of your hospital. There will be proper staff patient interviews, files, statutory compliances, mock drills, and all these things. For these statutory compliances, this is something which we need to have. We should try and have an occupancy certificate. They just need a document. They do not want whether it is 2-story or 3-story, just a document. That is what thing that is needed. Then for fire, people are getting very, very stingy about it. You need to have a fire audit. A third-party audit also works nowadays. And you need to be slightly compliant with the law of the land. And the biomedical waste management is very easy to get. So there are all 10 chapters. Each chapter has some prerequisites which needs to be documented. The first 5 are patient-centered standards, and the second 5 are healthcare management standards. You try and tick mark all those things, and you are going to clear it. There are few quality audits, the clinical audits that you need to take care. Then there is something called, in case you do not have something, suppose you do not have a proper lab, you do not have a proper laundry service, all you need is an MOU. You have to have a proper MOU with the right persons so that you can show that as per our protocol, we outsource these things to the particular lab or to the particular hospital to take care of our emergencies. And this is the written protocol, and this is written and everybody knows it. So then they actually give you a benefit of doubt. The hospital is all decked up, the signages, the scope of work, the patient's rights and responsibilities, patient information. These the codes the staff training has to be done, the code red, blue, pink, purple. This is a part of it, otherwise you'll have NCs in this. So finally, electronic medical records that Dr. Vinay is going to tell us. Sooner or later, you have to have it. So it helps in a lot of NABH tick marks that you can do, because once you have EMR, you know, a lot of patient care standards are actually fulfilled by that. So accreditation cannot be ignored. It is a process that you have to enjoy and make use to your advantage. Try and train your staff so that it comes as a second nature to them, that this is a part of their job. They have to fill all these things. They have to maintain these registers, so that once the the assessment comes up after every 1.5 years, and so you are ready for it. So take home is that it is easy. You just have to have few statutory compliances, some paperwork, but it is an exam that you are going to pass, come what may. Maybe with a supplementary, that's it. But if you apply for it, you are going to pass. So don't worry about it. Thank you.
And thank you, Ashish, for clearly highlighting that, result exam का 100% ही होना है. थोड़े बहुत supplementary लगे. I think this is most important because that is what the biggest scare is. And it's a lot of paperwork, but at the end of the day, you feel that you are giving your best to the patient and things are in place. So when you feel things are in place, that is what the goal is achieved.
In fact, Dr. Parul had just recently got NABH accredited, full NABH. And when we were talking about it, I was telling her that you are going to pass. And the fact that you are trying hard to, prepare for the exam, so that is more than enough. You have to pass, and she passed with flying colors. There was hardly any confirmed.
Thank you.
Sir, it is always better to give it to your staff, so that they keep on, as I said, it should be their second nature, that they need to fulfill all these registers and all those things. And obviously we need to block some hours for that, which is, again, once you get the assessment, you become little lethargic, and then once the assessment comes again, then you start, preparing yourself. But I would say that it is better that we do it in the regular way. We do try to have one.
Can you please ask it on the mic?
Okay.
Mic दे देंगे. Mic दे दीजिए.
Okay. Sir, they may not even ask for it. You can go for an entry level first, NABH. They will be asking you about, if it's in a residential area, you should have an occupancy certificate for a residential area. You can have a third party audit for fire, which says that all these things are done for. That will also work. Biomedical waste management would not.
I have biomedical.
So if you apply for an entry level, I am sure you will be clearing it. No problems. They are not going to go into all those details for entry level.
Okay.
You just apply for it. Entry level is not so.
Entry level is what?
So there are two levels. One is an entry level NABH accreditation. The other is a full NABH accreditation.
Okay.
So you can go for entry level. Even in the residential area, it will pass.
Okay.
Even full NABH, I am realizing it. I was reading between the lines. Even that can be passed, because they are not very jittery about it. They need an occupancy certificate. You can try and maintain something like that.
But fire I'm not getting.
No, you don't need fire. You just, where are you working, sir?
In Bombay.
Bombay? So then you can have a third party audit.
What is third party?
Third party audit is that there are certain fire agencies who are going to put up fire extinguishers and all at your place.
Okay.
And they are going to give you in writing that they have placed it and they have trained your staff, and that this place is fire compliant for a lot of things.
Okay.
So that document will work for you.
Okay.
So
But
we'll
legally I can practice without nursing home.
Sir, that the law of the land says, but then you are practicing it for quite some time.
Yes,
so nobody is saying anything. So
Nobody.
even entry level